Okay, so I think we have most of the participants in the room, and I really want to be able to, get started on our information today. So welcome everyone to session 3. Really excited to have all of you here. So as you know, this is Recruitment Boot Camp, Mental Health Staff Edition. Today, let me see if I can click through. We are going to have Dr. Adija Owunyemi. She is a clinical social worker. She works in a health center in Detroit. She's also an adjunct professor, social innovator, and she'll introduce herself in a little bit more detail. But I always have the pleasure of introducing her because her and we did our doctorate together. You know, she's done in California in social work, so I know that she's awesome. She brings just great experience, and I think it's going to be a great session. So before we get started, similar to before, just some housekeeping items. The session is being recorded. We're going to be posting all recordings, the PowerPoints, everything you need is on the discussion board. If you have any issues accessing the discussion board, reach out to Mariah. She will be able to help you. So we really love all of you to be present, be on camera if you can. I understand that, not everybody's comfortable with that, but if you are, love to see your faces. Use the chat box. You can also unmute yourself. I will be keeping track of the chat box as we go through the presentation, so I can answer there, also pass it on to Dr. Owunyemi. Also, you can, any comments, thoughts, whatever you would like. If you are having technical difficulties throughout the presentation, Mariah will also be your go-to. And as always, please complete the evaluation at the end. That's really helpful for us to know how we can improve and what you're enjoying. So with all of that said, I am going to go ahead and pass it to Dr. Owunyemi so she can introduce herself a little bit more, and then she'll go over the agenda and all the content.
All right, thank you so much, Michelle. Good afternoon, everybody. Once again, my name is Dr. Adija Owunyemi. I am a clinical social worker here in Detroit, and I work at a community health center. And I've been in the healthcare space for about 14 years now. And also, I teach sociology at a community college here in Detroit. And in the social innovation space, I engage in a lot of programs just like this to not only enhance my profession and its workforce, but also to do mental health promotion with companies as well, as far as employee assistance. My specialties are mental health and substance abuse in primary care. And once again, my professional titles are social worker, faculty member, and social innovator. For our agenda today, we would cover some of the key roles of mental health providers in the community health center space. We'll talk about what it takes to build a recruitment team and what a recruitment team should look like. We'll go into discussion about advertising and social media, and also how you can establish a workforce pipeline with your organization. So now we'll move into some of the general overview, and differences of difference in the roles of mental health providers. Finding the right professional is easier when you understand, and finding the right professionals rather is easier when you understand the different areas of expertise and trainings. You'll be surprised how a lot of people in leadership positions don't really know the differences between the mental health providers in a department. And this understanding is essential as you prepare to recruit and retain, not so much focusing on recruitment, but retention is also important, right? Recruit and retain mental health providers. And we'll go over some of the main mental health professionals in community health settings. And please keep in mind that while these job titles and specialties may vary by state, the essential functions of them are the same. So I have a chart right here that breaks down like a mental health department and the key departments that are underneath that. So within a mental health department, you have a group of people that provide psychotherapy and assessment. You have a group of professionals that provide medication management, and then you have another group that provides enabling services. With the group that provides psychotherapy and assessment, we can go on the next slide. There are psychologists, clinical social workers, and counselors. We'll start with psychologists. For the psychologists, they typically hold a doctor of psychology degree or a PhD or just a PsyD. They are trained to evaluate and treat illnesses using clinical interviews, psychological evaluations, and testings. Some of the benefits of having psychologists on your staff is they can do specific psychological testings that some of your clients may require, and they're the only ones that can do that. So that's a benefit of having a psychologist on your team as a part of your behavioral health department, mental health department. I'm going to be using those two things interchangeably. They're trained to evaluate also and treat mental illnesses. They can make diagnosis and provide individual as well as a group therapy. Some may have training in specific forms of therapy, like cognitive behavioral therapy, which is like one of the most popular forms of therapy, DBT, dialectical behavioral therapy, and other therapeutic interventions. For licensure and credentials, psychologists they're licensed by their state board. So if you're looking to hire psychologists, make sure that they're licensed with their state boards. The next types of professionals that provide psychotherapy and assessments are clinical social workers like myself. The cool thing about social workers is that we don't necessarily have to have a doctoral degree to provide clinical services. And the social workers are trained kind of similar to a psychologist. Why psychologists are focused mainly on like the brain functioning. Social workers are trained on the biopsychosocial aspects of human beings, right? We look at everything. When a client comes into the clinic and they're saying they're having issues with depression, we want to know what is the history of depression in the family, what is the environmental factors, and as well as social factors that may be impacting a person's mental health. Examples of licensure for social workers includes LCSW, and that's like the most popular one. However, based on the states, like an LCSW in Michigan is an LMSW. However, LMSW in another state is a limited licensed clinician. So you just have to understand what is a fully licensed social worker, what is their credential in your state, and that's what you want to target. And also seeking candidates that are fully licensed is ideal for a community health center setting because having a full license allows your social worker to be able to bill independently. If you have someone that doesn't have a full license, then you have to get someone else that would be a clinical supervisor that signs up on their notes so that you can bill for that. Also, the benefits of having someone that is fully licensed, you would avoid delays with your billing that can occur when you need someone else to sign up on encounters. The next type of clinicians that are under the psychotherapy and assessments are counselors. And counselors are usually master level healthcare professionals, and they're trained to evaluate a person's mental health, just like a psychologist and the social workers are trained. They do hold a variety of job titles, including counselor, clinician, therapist, or something else based on the treatment setting. Licensure varies by state as well. Examples of their licensure includes a licensed professional counselor or LMFT, the licensed marriage and family therapist. Those are the two certifications or licensures rather that you want to go for. Again, they're LLPC, those are limited license. And this is not to exclude limited licensed professionals from working in a community health center setting. However, remember, we're thinking about how can they help move the organization forward. If you have someone that is limited license, that may cause some delays and they have to take their tests and all of that. So just to avoid some of those hurdles that might occur when you have limited licensed clinicians on staff. Medication management is another department within a mental health, behavioral health department, and within that group of professionals, you have primary care physicians, psychiatrists, and psychiatric nurse practitioners. For primary care physicians, of course, they have a doctor of medicine degree or DO, or doctor of osteopathic medicine, and they're licensed by their state as well to practice. Psychiatrists are another type of provider that provides medication management. Of course, they have an MD as well, and they're licensed by the state where they're practicing, and may also be designated as a board certified psychiatrist by the Board of Neurology and Psychiatry. So if you have someone that has that, that's an added benefit as well, because it means that that's like their true specialty. The next type of clinicians that provide medication management within a behavioral health department are psychiatric nurse practitioners. And I believe this is actually the future of psychiatry. As someone who works in a community health center setting, we've had a lot of difficulties recruiting psychiatrists. There just aren't enough psychiatrists in the nation. And this is something that every state is going through. I think that one of the key ways to provide psychiatric services to patients is to really tap into psychiatric nurse practitioners, because they can do just about the same thing. And in some states, they're qualified to prescribe and monitor medication independent of supervision. However, Michigan is not one of those states. I think Chicago and Florida, they can practice independently. So if you're in any of those states and you're having difficulty finding a psychiatrist, you might want to look into psychiatric nurse practitioners, because they can provide some of those basic services that clients need, especially in the low-income communities where community health centers are located. Lastly, we have the enabling services. A lot of times we don't think about this as an integral part of the behavioral health department, but they are really important because they can help address a combination of social determinant of health barriers to access primary care, and they're also intended to reduce health disparities. They can include some of the services that they offer includes care coordination, health education, transportation, assistance with food, shelter, and other benefits. And if you have someone or enabling services department, enabling services team within your department, it would really help move forward the services that you offer. It really makes your department strong. Enabling services in the next slide, they can include social workers, community health workers, certified peer support specialists. Social workers, within that could be social workers that have a bachelor's of arts degree or bachelor's of science, and they provide those case management services such as people applying for health insurance. I don't know about you, I don't know if you're familiar with this. A lot of community health center patients don't even bother seeking care because they don't want to go through all of the applying for insurance, because it can be quite intimidating based on other factors for people to apply for health insurance. So if you have a social worker on your staff, they can help them do that. That's always an added benefit. Community health workers can also do that, as well as certified peer support specialists. So why, in the next slide, we want to look at why does clinical staff, and whether your staff is clinical or not clinical, why do they need to understand the different clinicians within a behavioral health department? The first thing is that they themselves will be educated on the type of mental health services that are available at your health center, and also be able to make appropriate referrals or consultation. I can't tell you how many times I get referrals for case management. And I am a social worker. I know how to do case management. However, I am clinical. So we've had to do, a lot of education in the past with our staff so they can know who to direct different referrals to. I'll get referrals about somebody needs a food, they need food. I can do that, but we also have a department that does that. So in order to avoid a lot of those unnecessary referrals that goes to people, it can help them just focus on what they're doing, and persons can go about and assist the patient in the areas that they need help with. Now we'll move into what it takes to build a recruitment team. What should be a part of the recruitment team? A recruitment team should be an example of the key departments of your organization, the key department of your organization's workforce, and having a diverse representative sample of managers and employees will give a candidate a representative sample of your company's demographic and operations. I know that sometimes it can be intimidating for people to come in and they're meeting with a team of people, but for me, in my past experience, I've found it to be beneficial because it really allows me to ask different questions about, the job and the nature of work, during my interview process. So it can be a mutually beneficial experience. And some companies have also found it to be beneficial to include a behavioral health director in all of their recruitment efforts, because they know the benefit of having someone that's trained to ask questions and assess other people in the team, in the recruitment team. So examples of what a recruitment team should look like including someone in your senior management, C-suite, whether it's their CEO, the CMO, or the chief operations officer, or whether or not they want to rotate, because I know that a lot of times they have a lot of responsibility and they can't always be available. However, maybe if you rotate, who will be a part of the recruitment team for this particular 3 to 6 months, if you can do it that way. Of course, having a behavioral health director on the team, a provider. So it's not just to have a director of the department, but having someone that actually does the work from day to day, that can give a great insight on the nature of the work. A lot of times candidates quit or they resign because they feel like they weren't well informed about a role. However, if you have someone that does the job from day to day, that can provide them with real life insights on what the job is like, it will give them an idea of what they're signing up for. The job is not easy. However, I think if we start with transparency right at the gate, it really helps people to decide whether or not they want to join your organization, and it will also be a determining factor in retention. Of course, we want to have human resources be a part of recruitment. Also, maybe if you have a union or employee association representative, and also someone in the enabling services, whether it's the peer support, the social worker or the community health worker, someone in the enabling services department would also be beneficial. It could be an added, benefit to the job when a clinician knows that, okay, I will only be focusing on my clinical work because I have another department that can handle some of the case management services that just about every community health center patient has whenever they walk through the door. So it's also important for us to, in the next slide, establish clear roles, establish responsibilities, and be aware of people's availabilities as well as their skills, right? Some people might be better with one-on-one interview. Some people might be better with observing. Maybe you give a case study to a potential candidate, and some people might just be there to just observe, that person with that case study or that assignment, so to speak, during the interviewing process. I've been to interviews where in a community health center where it took like an hour and a half. They put me through a different types of interviewing modules, and it was actually pretty cool. It gave me an idea of the organization. I had a walkthrough, I had the case studies, I met with HR, I met with the behavioral health director, the CEO. It was good. I ended up staying with that company for 3 years. It was a good experience all through. Also, the types of roles, you also need to establish, in addition to establishing clear roles and responsibilities, you have to be able to, in the next slide, divide up the task among the recruitment team. For example, in the hospital, a bulk of my earlier work as a clinician was in a hospital. And in a hospital, we have what is called a rapid response team. And rapid response teams are teams that are responsible for responding to hospitalized patients with early signs of deterioration. So if you've ever been in a hospital, you hear cold blue, the rapid response team rushes to the person's room, and they of course provide immediate life support in there. And that response team is actually made up of people who are key departments who are in the key department of the hospital or the organization. So you have social workers in that rapid response team, the nurses, respiratory therapists. Think about that as a part of your recruitment. Make sure that everybody has clear roles, define their position, work with the community partners, source out candidates, screening and interviewing. Who's going to do all of those things? Who's going to define the position? Maybe HR needs to do that. If it's a mental health position, maybe the behavioral health director needs to do that. Work with community partners. Look at what other community health centers in your areas are doing. Source out candidates. Who's going to be responsible for doing that? Who's going to be responsible for screening the resumes and interviewing, managing internal logistics? You have to be able to have a recruitment team that is clear on what their roles are, because it really would be fruitless when you have people that are doing the same things at the same time. we won't make any progress there, and it will lead to a lot of confusion. Now we'll move into advertising and social media. And this is a big one. It's very important. So now that we understand what type of mental health professionals they are, and maybe the type that you would need in this present moment, and you have a recruitment team, you're ready to proceed to advertising and social media. Make sure that you understand those first two things that we talked about before you start advertising. The reason is that you need to be clear. You have to know what you're looking for so you can be clear on the messaging. First, we need to talk about language. Language is very important and it matters. One of the first steps for us in developing an effective job posting, one of the things that we need to consider is language. For you to attract high quality candidate, you need to consider using the language that are not only inclusive, but attract the right candidates for your organization. When I say inclusive language, I mean using your words wisely. Using inclusive language means that you're intentional about your choice of words, and you're careful not to use words that marginalize groups of people who may knowingly or unknowingly be discriminated against because their culture, race, ethnicity, age, disability, or any other factors, that shouldn't play a role. Another thing is that I don't know if you all heard about this in the world of social media. Speaking of social media and advertising, a couple of months ago, there was a nurse practitioner that got in a big trouble on Instagram because she did an Instagram reel and was making fun of the clients that she serves about, calling a client and they don't pick up and they come back 3 months later with STDs. And she was making fun of it. She ended up losing her job because it marginalized a group of people that are already disadvantaged. Right? We have community health center patients that are low income. They have a lot of social determinant of health issues that impacts their ability to access care. And then you have a nurse practitioner on Instagram making an Instagram reel about that. That wasn't very wise. She ended up losing her job. There was a lot of outrage about that. So language is very important in looking for candidates. And also when you have candidates, make sure that they understand where you stand about the clients that you serve and what you expect of them as an organization. For example, and also in a 2019 study from LinkedIn, they found that words impact people differently. So the language different genders use to represent their experiences may vary. Open language is more than likely going to attract gender diverse candidates. And when we say open language, we mean using words that are viewed positively by gender diverse candidates. In the LinkedIn study, people reacted equally positive to language such as powerful, strong-willed, confident. You say we're looking for a candidate that is confident and blah, 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 blah. Using those type of language. Also, when applying for roles, women are more likely to prioritize terms that relate to their character, such as likable. It is a supportive work environment. It is a likable, using words that shows your organization in a positive light. That makes people feel like this is an organization that I'd like to be a part of. The more definitive terms are viewed as off-putting. For example, 44% of women in that study, they said they'll be discouraged from applying for a job where if the word aggressive was included in a job description. It shouldn't be there anyways, but if it was included in a job description, women said they would be less likely to apply for that job. So all of these things are important for us to understand. And when you're trying to appeal to the right candidate, it is important for you to remember that it's not just about the skills. Individual character matters. Skills get people through the door, but their character keeps them there. Right? The character keeps them there. Do they really care about the clients that they're serving? Do they really care about that community? Do they really care about the improvements of health outcomes of disadvantaged or medically underserved communities? Using language that connects or appeals to the right candidate, the soft skills will help you to find the mental health providers that will be great additions to your organization. So it's important for us to consider language. Also, digging a little bit deeper into language in the next slide, be thoughtful about how you describe your company. How are you talking about yourself, right? Think about if you were to, go for a presentation or conference, how are you talking about yourself? That's also important. Consider using words like supportive, diligent, confident to describe your ideal candidate, and pay attention to how the workplace atmosphere is depicted. Your workplace atmosphere has to be in harmony with the words that you're using to describe your organization. They can't be in disharmony. Also, most job descriptions today highlight the skills or qualifications as well as educational background, which are important. However, in order for you to truly match what people to truly match how people describe themselves in job descriptions of your job posts, consider being more descriptive about the kind of candidate you're looking for, right? And this is where data can come into play. Yes, all community health centers are located in low-income communities, but the primary challenges of those low-income communities might be different. In one community, it might be there is a increase in STDs in that community. How are you going to put that in a job description to say, here's an area that we're really working to improve in this community, and we're looking for someone that's passionate about working with people that have challenges with their health, right? Or it can be another community. In my particular community health center, we have 5 different locations, and with different communities I see differences, like the primary challenges are different, right? One community, STDs is like the major issue there. We have a lot of patients coming in for STD checks. Another community is the high blood pressure and diabetes. That's a main issue. One community is substance abuse issues. So how do you, knowing all of those things in your data, how do you then communicate that to the right candidate? Because if you bring in somebody that's not passionate about education or is not comfortable with doing diabetes education with clients, they would not be the right fit for your organization. So knowing that data and using it to your advantage in communicating what your specific needs are is important. In the next slide, I want to talk about mission statement. Another thing for us to consider when we're in search for providers that are connected to is that when you're looking for people, you need to keep in mind that you want to connect with providers that also connect with your mission. And also you need to be able to communicate your mission. What is the mission of your organization? If I ask anyone today, can you please just drop a sentence in the chat box? What is the mission of your organization? What is it? I would love to hear it.
Yeah, and feel free to put that in the chat box, or if you want to unmute yourself, because it is incredibly important to know that as a driver for your work.
If you want to go on your website really quickly to look at it, yeah. That's fine too.
Adija, if it's okay, I wanted to add one thing what you were saying with the job announcements and the language. As Dr. Ogunyemi was talking about the importance of having actual providers on the recruitment team as well, leverage them to read your job announcements, because some of the things, especially with mental health, when you're putting in certain terms that clinically mean very different things than just kind of the way that you may be using them day in or day out, if the focus is not really very strength-based, it seems very negative in the way that services would be offered to clients. And I know that most of you would be saying, no, but that's not what we have in our job announcements at all. But, clinicians, especially mental health, speak in a very specific way. So one thing that I always say is you don't want to say sympathetic. That is not positive. That is negative. You want to always use empathetic. And for clinicians, they would view it that way. So it's very important that the language is so carefully addressed, because it is going to tell someone, okay, this health center, they know what, they know how to support me as a mental health provider or not. But okay, I see people put in into the chat.
Yeah, so Helen said to improve the health of America's underserved populations and to enhance the development and support of clinicians who serve them. That's ACU. Mm-hmm. Alicia said to deliver comprehensive, high-quality, patient-centered health and support services in, I don't know how to say that. How do you say that? Chautauqua region, and that's the Chautauqua Center. Thank you, Alicia. Deborah said, Rural Health Group's mission is to offer highest quality healthcare to all in a culturally sensitive and compassionate manner with special emphasis on reaching the underserved. I love that. Culturally sensitive, compassionate. Those are keywords. Val de Sol inspires positive change by investing in health and human services to strengthen families with tools and skills for self-sufficiency and in the building of the next generation of Latino and diverse leaders. I love that. At least she said it's a mouthful. Chantel said, provide affordable, accessible, and quality healthcare, promoting, sorry, I missed that. Promoting learning opportunities for students of health professions. Okay, and in homelessness, improving quality of life in our communities. Chantel, that's a really good one because we're going to talk about that piece in a minute, the workforce pipeline. That's a good one. Kevin said, Whitman Walker Health is committed to cultivating and sustaining an environment in which team members from diverse backgrounds lend their voice and experience to delivery of care of our patients and clients. The strength of the diversity of our workforce helps us recognize and respond to the conflict needs of our communities. And we recognize the need to achieve diversity at all levels of our organization, and we believe in the value of mirroring the patients that we care for and with the staff on all our teams, the intersections of diversities, identities, and indeed the celebrations of those intersections are a major ingredients to success. Very good. And then lastly, Betsy said, we have this interesting names today. How do you say that, Betsy? How do you say the name?
Amaskeg.
Amaskeg. Okay, Amaskeg Health. The mission is to improve health and well-being of our patients and communities we serve by providing exceptional care and services that are accessible to all. Those are really good ones. A mission statement is something that is short, and it's a short formal summary of why your organization exists, and also it talks about your values and your purpose of the reason why you exist in the first place. Those are really good ones. For those of us that our mission statements are a little longer, you might want to consider just making it a little bit shorter so it's easier for someone to read as they're, quote unquote, scrolling by on your website. Also, in the next slide, we also have vision statement. I think that's probably someone's vision statement because incorporating your vision statement in your job description can also be helpful because it communicates to the candidate where the organization is trying to build and serves as a touchstone for future actions. And it offers a picture of where the organization hopes to be in the future and can connect you with people that also believe in that vision. Right? What are you trying to accomplish in the next 5 years as an organization? That may help you draw the right people because they see that, oh, this organization is trying to move forward. This is what they're trying to do. I would love to be a part of that change movement, right? That's important too. So whenever we're looking at mission and vision, in the next slide, just consider also the recruitment process, the retention process as part of the recruitment, right? Finding the right mental health providers that are connected to the mission of your organization. A provider that is connected to your mission and your vision would not only be an engaged employee, but it'll also be connected to the patients that they serve, right? I work right now, we work from home most days, and I had a patient that had a crisis in the clinic. They called me. Dr. O, your patient is here. This is what's going on. I was able to talk to the patient and calm the situation down because I have a relationship, right? And when you have providers that are connected, actually care about the people that they serve, you get that type of service that patients knows, this is my medical home. When I go there, I know that my needs will be met, or they'll at least try to refer me to the right parties that can help me. And like we said, the language matters in how we talk about our organization. The purpose of our organization matters, and also it's important for us to have an application process that is user friendly, right? Make it a short one where it will give you enough information that you need about the candidate. And maybe if you're interested in the candidate, the next step could be to fill out a more extensive application. Long applications turn people off. All right, now we're going into advertising. And in the next slide, we are talking about advertising, writing ads in advance. Right now, who's responsible for writing ads? in your organization as it relates to mental health providers? Who's responsible for writing the ads? You can unmute yourself to speak or type it in the chat box. Deborah, are you HR or behavioral health? HR. Anyone else who's responsible for writing ads? Recruiter, HR generalist, okay. If it's a mental health provider, I think a behavioral health director should be responsible for writing the ads. And of course, HR can edit it to make sure that it follows HR guidelines and things like that. But if it's a mental health provider, the behavioral health director should be responsible for it. So if that's not something that you're already doing, you may want to give what you already have in place to a behavioral health director and have them look at it and see if it's something that can be improved. Customize ads to for each type of position and media outlet. And I'm saying this because this is something that I've also experienced in my current role. What happened, there was a shift in our organization 2 years ago where we couldn't find mental health providers for whatever reason. We just couldn't find mental health providers. So what the chief medical director did was she called some of the key people in the department. She called me, she called the coordinator and myself, and she asked us to just come up with a job description. And we did. And they also made us a part of the interviewing process. And I will tell you, knock on wood, everybody that we've hired actually, that was 3 years ago. So everybody that we've hired are still with us 3 years later because we're a part of that process. Whereas before they were having high turnover issues. So I think there's some benefits to having people that actually work in the day-to-day aspects of the role be a part of that process because they can provide, honest feedback. And we basically just had a conversation. We're all peers, right? People have the credentials, the educational background and whatnot. But it's all about, hey, this is how this department is. This is how the clients that we serve, this is what they look like. Are you experienced in working in this area? Yes or no? If you're not, okay. If you are, or if you're not and you want to learn, okay. If you are and you're comfortable, very good. So we've had both of those clinicians come into the door where somebody has never worked in a community health center before, but she was willing to learn. She's still with us. There's another person that worked in community mental health, which is a little bit different. She's still with us. So making sure that you write those ads in advance, write something that's compelling, write something that highlights your health center, what makes your health center unique, highlight the community, include benefits, some positives about your health center and why it's a great place to work. And right now, people are looking for flexibility. So I think that companies should start considering at least offering one flex day for your clinicians to work from home. Telemedicine is here to stay. However, it shouldn't be like the basic care, right? We still need to see our patients like face-to-face, one-on-one. Sometimes it's all about energy too, right? But making sure that you offer clinicians at least one flex day that they can work from home or work remotely and what have you. I think it's an added benefit. All right, in the next slide, we're looking at your website. And when we talk about advertising, it needs to start from your website and then go from there. Does your website needs to be updated? That's something that we really had to work on when COVID hit last year. Our website was okay, but it needed a little bit of a facelift. And when COVID came with all of its many interesting twists and turns last year, I think that our IT department was ready. They really had to do a lot of editing to accommodate patients, make it more user-friendly so they can go on the website to check in for their appointments and things like that. We'll start with your website. Where if it needs updating, invest in it. It's so important. Your website is like your company's resume, so to speak. What are your services that you offer? Are those things highlighted on your website? What type of providers do you have? Do you provide OBGYN services, pediatric services? What kind of services do you offer? Are these highlighted on your website? Do you have staff or patients that are willing to offer testimonials that can be published on your website? Those things speak well of your company and they should be on your website. In the next slide, we're talking about branding. If branding is not something that you've already done, everybody needs some type of branding. Make sure that those things are authentic to you, though. It shouldn't be that you say that your place of work is this wonderful, and then people come in and it's not that great. Be realistic about what it is and what you're trying to improve. Be realistic about that so people can manage their expectations too when they walk in through the door. A brand is made up of perceptions, is made up of the perceptions of its touch points and is an image that is built on opinions, reputation, and perceived characteristics of an organization. Again, highlighting those testimonials is important because it allows people to see people's past experiences working for and receiving services in your organization. And when you think about brand, you need to think about, obviously, everybody's organization has a name, but do you have a logo? Do you have an identity? What's the quality of the type of services that you provide? And what is your strategy as an organization? Do you just want to be an organization that's known for providing services? Or do you, like someone said in one of their mission statement, they talk about students also, the workforce pipeline, students also being a part of that. That could pique the interest of somebody that's receiving services in your organization to want to volunteer and see if this is a type of place that they want to work. Organizations that have type of like residency programs in place or internship program in place, they also stay around for a long time. That workforce pipeline really helps to build the organization. And what do I mean by that? Think about residency. When you have doctors that are coming to do their residency at your clinic, after they graduate, some of them stay. And that's how you recruit and retain people, because they've already worked there, they stay. And that's something that I've seen in the past as well. In the next slide, we just talk about the different other things to consider, such as, whether or not you want to use paid ads. Do you have a blog post on your website? Blog post gives people like an idea of what your organization is up to. Did you guys just do a breast cancer walk? Making sure that you put that on your website. Or do you have a behavioral health clinician that's been with your company for so many years? Have them write something about what, the kind of services that they offer, or how they find fulfillment in their job. Have them write something to put on the website. On your website, also have job descriptions there. If you have open positions, or even if you don't have open positions, you can have the different departments and what they do on the website. So people that are coming, quote unquote, virtually walking by, they can see those things. Career pages on website is important as well. Photos of current staff, photos of patients. So patients don't mind signing that release of information so that you can put your pictures on the website. Using those things to depict your health center in a positive and authentic light. In the next slide, I want to talk about social media. I already talked about that a little bit. Social media has its pros and cons, but it can definitely, when it's used appropriately, it can be a great tool. You should already have a social media presence. Do you all have, does your company have social media, whether it's Facebook or Instagram? Do you have a social media presence? You can type yes or no in the chat box, or mute yourself to speak. Do you have a social media presence?
And Adija, I wanted to add one thing while people are writing in.
Yes, go ahead.
That your patients, very similar to what Dr. Ogoyemi was talking about, of having them prominently on your website, they should be part of the branding. You're bringing in the mission-driven people, and you should talk about your patient population and how you work with them in your job announcements. Attract people that either are part of that population or want to work with that population, and at the baseline, it's about serving them. So it's really, really important to highlight those things in any job posting. Yes, and then I see people are writing into their into the chat.
So people said yes. Okay. Oh yeah, Michelle put that website there. I've heard of that as well. Chantel said yes. You should already have a social media presence. You should have at least post like once a week so it's updated. I shouldn't go on your website's Facebook and then the last post was in 2015. It should be something that's current, that kind of informs clients of what you're up to, because whether we like it or not, people get their information from social media. And and for some people, not to pick on any particular generation, But for some generations, that's where they get their news. So having things, up to date is important. Michelle, you were going to say something?
Yeah, and because I'm glad that you brought that up. One thing I wanted to point out, Facebook is no longer, now it's called Meta. So right. So wanted to point that out. The other thing too, I think Dr. Onyemi brings up a great point about generations, because also know who is using what social media. A lot of health centers use, I guess, Meta now, formerly Facebook, but most millennials and especially Gen Z, they're not on that at all. We had a workshop recently for workforce, and most of the health centers that were on there, that's the main one that they were using. And anybody from those generations was like, I haven't been on there in years and I don't use it at all for any type of job postings or anything. So really LinkedIn is the place to go. And many people too, like people that ask, oh, is Instagram where you would go, or is Twitter? Actually Helen from our team made a really good point on the work-life balance, that my Instagram, my Twitter, all of that is for my personal stuff. LinkedIn is my professional stuff. So I would seek that out there. But you got to keep up with like, what are people actually using? Because there's many people that, you're posting somewhere and you're not reaching who you want to reach.
Yeah, that's a great point. Helen, you have your hands raised?
Oh no, sorry, that I was just doing the wave emoji to say hello everyone. That was me.
Okay, in the next slide, we also want to talk about the importance of utilizing websites that would allow you to be able to reach diverse candidates. The National Hispanic Medical Association is one, National Black Nurses is one, National Association of Hispanic Nurses, since we have a little bit of cold, National Medical Association, or the Out Professional Network. In the next slide, I also included the National Association of Social Workers. A lot of social workers are well connected with their local NASW chapters. And a lot of them they get a lot of information regularly. I'm a part of the NASW chapter in Michigan, and people are I don't want to exaggerate, but we have thousands of people that are members of the organization. And obviously you have passive members too. Those are people that don't pay their membership fees, but they follow the organization of social media platforms. So being connected with those organizations also could get you the right candidate, because if you send them we're looking for a job, they'll be more than happy to post it for little to nothing. So utilizing those professional organizations, I think should be a part of your advertising and social media strategy. In the next slide, we want to talk about recruiting. Recruiting can be in two folds. We can go to the next one. It can be in two folds, whether it's active recruiting or passive recruiting. Active recruiting is when you have people that are actively seeking out a new position or an organization, and they account for about 25% of the workforce. We also have the passive recruiting, and those are people that are not actively seeking a new position or organization, but they may be willing to explore a new opportunity if the right opportunity comes along. And they account for 75% of the workforce, and it is higher for physicians. So this is where I want to talk about LinkedIn and the importance of LinkedIn as a tool for passive recruiting. Your HR, I know everybody has their own, they want to separate work and life and what have you. Your HR, if they don't feel comfortable utilizing their own personal LinkedIn, maybe they need to have another LinkedIn for HR, so that they can start engaging and being connected with different people that they would like to be a part of their organization. That's how you can possibly recruit people. And LinkedIn is a great tool actually for a lot of jobs. A lot of people find jobs on LinkedIn. And I believe it's through that passive recruiting. When your HR, they have their LinkedIn account, make sure it says like an HR specialist or a generalist on their, their header. And then they can say, oh, we're actively recruiting, and they can like connect with people that they think would be a great addition to their organization. So I think LinkedIn is the way forward. I also saw something that was pretty cool on Indeed, where you can actually have your interview on Indeed virtually. they added another tool to Indeed where you can do interviews directly from Indeed. So that's something that is worth looking into. Although we hear that there's a national shortage of employees, but I also think people are looking. People are not settling. So how can you get the right candidates? And when I say right, I'm saying that a great addition to your organization, because what is right to people can be different, but somebody that can be a great addition to your organization. So using those tools that are out there, because people are, in the past, people were just taking jobs that in some ways seemed okay, but now, especially in the past year, where people have realized they can actually live with a little, they're being more picky about the freedom that they need to have with their jobs. So it's important for us to be aware of that. Lastly, we want to talk about establishing a workforce pipeline. And somebody mentioned that in their mission statement. And before you begin recruiting and on an ongoing basis, be aware of other planning initiatives in your region. In the next slide, we have a list of community partners. You can be a partnership with hospitals, other providers in your area, schools, residencies, state offices, and primary care organizations. How can you be in partnership with the hospital? It can actually be twofold. There are some psychiatric hospitals that sometimes may have difficulties getting appointments for patients when their discharge is pending. If they know that you will take their patients, you want to likely get all those calls for all of those discharges. Because social workers, the hospital, we all know that it's a fast-paced setting, and social workers are looking to get, patients discharged. I know how that trickles down because I work in a hospital. It's not just the social workers, it's the managers and the hospital. Anyways, it's a whole thing. But in order for patients to get discharged, there's a lot of departments that have to sign off on them. And part of discharging a person, especially from a psychiatric hospital, is like they have to have an outpatient appointment within a week or two of their discharge. Sometimes social workers have difficulties finding appointments for patients, but if they know that, okay, this person will be great in a primary care setting, and they know that, oh, your clinic, Betsy, your clinic is one that can take patients and get them in within a week. You want to likely get all those referrals. And that's how you build community partnerships with hospitals. Also, you can have a situation where maybe hospitals have interns and they're looking for a job after discharge. Because they already have those relationships, you can get that workforce, school to workforce pipeline established with them as well. Other providers in your area, schools are good ones. There's a lot of internship programs. Encourage your departments to be more open to at least taking on 1 or 2 interns. I think it's important, not only for the benefit of your organization, but also for the enhancement of the workforce. A lot of times in community health, the reason why we have difficulties finding staff is because they don't know what we do. I know a lot of social workers, and sometimes I still have to do a little bit of education about what exactly I do, because people, while we're in school at least, I didn't see myself working in an outpatient clinic because there was just no such thing that was talked about in school. So people don't know that this is actually another aspect of social work where they can actually find a job, and a rewarding job at that. So having that internship and making sure that you have partnerships with community colleges, those are always a good ones to like get students to come in. And students can be useful in doing those non-clinical jobs, so to speak, for your organization while they're learning as well. So those are things that we can do in order for us to enhance, the workforce of our organization. So now I would end it there. I want to thank everyone for your participation and interaction today. I just want to leave the last few minutes that we have for any questions that you may have.
And I did want to make an announcement. I put it in the chat, but just in case anybody came in later, for those of you who send me your job announcements, you will get feedback soon. So I will make sure to provide all of that to you. And then also opening up for questions. If you had any questions about the homework or anything like that, happy to respond to that as well.
Yes.
Oh, and I think Alex has a question.
Yeah, if you don't mind, kind of jumping back to the social media thing, and a lot of my experience with this is very anecdotal, but it seems like, you know, if you're working with community partners, especially educational institutions, telling them which sites, so say use LinkedIn more, uh, you know, to kind of encourage their students to create profiles. Because what I've seen is there's like, certainly like Michelle said, there's kind of a tendency for millennial and Gen Z to lean more towards that and less towards Facebook. But I have observed kind of peers as far as that generational group who were from different socioeconomic backgrounds who used very different social media. And so, you know, one of those things is like, we may have kind of our thought of like, oh yeah, LinkedIn is the place to go. But some people, especially if you're trying to recruit from a classically underserved community around you and find local providers who are, you know, maybe just going out of school, it might be worth like reaching out and telling the schools, hey, have your people create LinkedIn profiles, or even like, you know, come in and have a day where you show that or something. I don't know.
That's a really good point. That's a really good point, Alex. Someone asked a question about joining an NASW. Yes, I believe so. You have to be a social worker or have a social work degree, like she said. Yeah.
Right. Yeah. The key is having, because some people have degrees, but they don't practice as social workers, so it doesn't quite, you know, make sense for them to join the NASW. But as long as you have a degree in social work, you can join.
Any questions or comments? We have 5 minutes. Let's use it up. Your audio is going in and out, Michelle.
Oh, sorry, I'm having bad weather. I won't use the chat. I don't know if people can hear me.
I'm also interested to know what strategy or platform has been useful for people here in recruiting mental health providers. Is it like word of mouth, LinkedIn, Indeed? How have you been able to find your providers?
We haven't. That's why we're here.
I was thinking maybe you had one or two already. What state are you in, Betsy?
New Hampshire.
Hampshire, okay. Okay. So it might be something to consider, having like someone do telemedicine from another state in the meantime while you're trying to look for somebody in state.
Yeah, I've posted positions a couple times on CFHA, which I'm a member of, on the listserv and on their job posting area, because you can do that for free there. We're looking at possibly, we've gotten the mailing list from the Board of Licensing and are thinking about sending out a postcard or something to all the people on the mailing list to say we're looking. And somebody just wrote about the schools. Yeah, well, I've been thinking about that too, is we need to reach out, especially at graduation time, to see if there are students that are looking.
Do you have an NASW chapter there? You should.
Do we have any what?
National Association of Social Work chapter.
Yeah.
You do. I think it might be beneficial to somehow connect with them as well, because they would have like that mass mailing list for both new and, you know, like newly graduated social workers, people that are already in the field, that you can have, you know, it can expand that pool a little bit more.
Yeah, we talked about that just earlier today, actually. So
yeah. And the reason why I say that is I know that because I'm a part of the NASW Michigan chapter, and we post things and they're gone like that because, you know, it's going directly to the people that need to see it. Okay. All right. Over to you, Michelle. Thank you so much, everyone.
Or are y'all able to hear me?
I'm sorry, I didn't hear you. Someone said, who do we contact at the school to try to link with their alumni? You want to contact the School of Social Work, Deborah. The School of Social Work at whatever universities in your area, that's who you want to contact. And oftentimes they're very receptive to, okay, that's okay, Michelle. Oftentimes they're receptive to that because they want their students to be engaged in that way. So you want to contact the School of Social Work because they would have a listing of their alumni as well. It might be a little bit harder to go through the alumni department itself. Okay, all right. Michelle is having audio problems. I don't know, Helen, should I close the class or do you have anything else that you would like to add?
Hi, everyone. Yeah, thank you so much. Thanks for that contact, Dr. Ogunyemi. That content. It's really valuable and really important. We are really grateful. Just a reminder to folks that Michelle will be getting those ads back to you soon. Please definitely fill out evaluations as you see them. Let us know if you have any questions. We're here for that technical assistance. Feel free to reach out throughout the week before our next session. And beyond that, thank you all so much for being here, and we'll see you next time.
Bye, everyone. See you next week. Thank you so much.
Bye. Thank you.